And the one thing I see as just extremely critical to this is the EMR connectivity in that episode. And to the extent that that's there, and to have tools that are integrated with an EMR is just perfect. Because I don't want to speak too much for Kevin and Dr. Sodi here. If it's not in the EMR, it's not going to be top of mind as much to physicians. I mean, the burden of an EMR is incredible. And to have a system, though, that can prompt them, hey, did you remember this? What about that? Is there a suggestion that it can make about a better care path, a better choice? Some of that, I'll just call it artificial intelligence. And, at the end of the day, the clinician, the human, is every bit as important as a technology can assist. But it's good to have it there. And like I said, it all falls into place when those things are working well.
Yeah, so I think the perfect workflow would be you see the infection, the culture, you'll see the sensitivities, and you have your local antibiogram. How is this bug, what are the sensitivities or resistance patterns in your neighborhood? I want it to be actionable to the fact that I'm not looking at Johns Hopkins antibiogram, but my local here, according to my data. And I want it to be right in front of me. And that's sort of what I think about the workflow of physicians. So I want to be able to see what was the bug, where was it, and what is the right approach to treat it? Which antibiotics do I choose according to the local sensitivities to that? That is kind of the holy grail in my world, treating the patients, to be able to go one place, find it, and it sort of nudging me to use the right antibiotics, not the antibiotics that the local rep was pushing last week.
And then, Kevin, I wanted to comment as well that so GermSoft can also incorporate your hospital or your health system's antibiotic formulary. And so that's also, in terms of formulary compliance and really guiding clinicians, maybe I know I should use a carbapenem, but which one am I using now? Because there's a lot of new agents that have entered the market, specifically the beta-lactamase, and beta-lactam, beta-lactamase inhibitor combinations, all of which are somewhat nuanced to use. So I think the ability to incorporate that is really important as well.
The quality and the infection preventionist community is going to be looking like what are our outcomes? We want to make sure we're getting great patient outcomes, and an application that is easy to use by prescribers and will yield better compliance, and we have easier access to the data and on-demand reporting for information dissemination, education. That's great. Ease of integration with the existing EMR. We've all been around long enough to see where that doesn't work and what a burden that is on providers. And the ability to provide reports that identify trends and patterns in ordering and antibiotic utilization per provider is definitely a benefit.
A couple angles on that. The biggest one is again back to this episodic care and pay for performance. None of the payers, that being a CMS or a commercial payer like a Blue Cross or United, none of them are doing anything with an intention of paying us more. So, unfortunately, we're in a world of penalty avoidance, and I would say making up the perhaps reduced payments in volume in more patients. And no better way to do that than to show your value and your quality and have that get disseminated. And the thing I really like about, and this is what Kevin was saying, Dr. Sodi here, about, it can't be any more real time than how he described in terms of how GermSoft would be integrated. I mean, with value-based purchasing, there are significant payment penalties for that. The problem is that the feedback loop is literally, more than a year. We can't react or know about it for a year down the road. Sounds like with this tool, not only do the physicians have it at their fingertips, but we're going to have reports on it that are much more current deal with. So to get back, again, to get back to the payers though, I mean, how can we increase our payments? Well, one way to do it is to demonstrate the quality and value. One of the big things going on these days is plan design from an employer and payer perspective to steer patients vis-a-vis their plan designs to high quality, lower cost facilities. So, I mean, this is just one way to demonstrate that, hey, our hospital ought to be one of your preferred providers, that your plan design provides that incentive to utilize. So again, and to do so, there's better payments involved in that kind of track.
Kevin, when you're on that GermSoft tab on an individual patient, there's a space toward the bottom middle of the section on the right where it has all the information on current sensitivities and resistance in a clear one-click manner, and the protocols that are developed within the hospital are usually right there. So in your institution, are you finding that protocols are put together, and are they updated on a routine basis, and are they distributed, and are they easily accessible so that the whole clinical staff knows what's going on, so that care is done in the appropriate manner?
Yeah, thanks for the question. That's a very good question. You know, I'll go back to the rate of change of how we're doing things, even without COVID. For example, I'm just going to give you an example for the sepsis CMS bundle. So we have to do things very methodically in order to not fall out of that, which has significant payment consequences if we do fail. You know, the blood culture must be done, the antibiotics must be given, appropriate antibiotics must be given within a short period of a window period. COVID, the algorithms for the treatments. It is very hard to be able for any, you know, we have a big institution, a health system here, but all the health systems, it's very hard to implement that protocol where the frontline provider can access it very easily in most EMRs. It's just, this one of the biggest problems has been communication. How do you know something, how do you get it to the frontline clinicians that they can act on it? So I think this solution to be able to add something fairly quickly, some protocols are there for years, we ability to have that where I am looking at that data and I can look at the protocol and make the right, going back to that, all the behavioral economic stuff and nudging to do the right thing. I think it's very important. And as the rate of change continues to just increase, that is something that we need to figure out how to do. And it looks like the solution here with GermSoft, as you explained, Craig, it's a wonderful one that I don't have to click to go to another site and look up, you know, the algorithm. You know, the local algorithm, how we've decided to do it is right there, and I can see it to do the right thing.
And I think that really helps with antimicrobial stewardship too. So, you know, in the example of community-acquired pneumonias, and, you know, let's say you're starting azithromycin and ceftriaxone, but I need you to stop one of the antibiotics after 24 hours, 48 hours. So I think assurance of compliance, you know, with some of those types of therapeutics, it's really important to have those protocols just readily accessible. So your you know, end user, your average clinician knows what to do. And can help us meet our goal metrics.
We expect GermSoft to provide value within a week, really. And there's different timelines for different parts of the value. But the reason why it's so quick is that there's no change in the EMR. There's no additional technology to learn. There's no cognitive decline because you're focused on clicking and how to look on what part of the screen to go where you want to go. It's just working, and it just slips in. It has the same user interface as your EHR, your EMR, so that the clinical use of it should be within days. If Kevin is looking at patients with a UTI, he can click on that particular patient, click on the tab that would be relevant, would be the GermSoft tab, and he would have all that functionality that he can may have action upon within 30 to 60 seconds. But there's no learning curve because it's the same user interface. It's automatic API calls, automatic calls of the data, so the information's already populated by the time he clicks onto that site.
From my standpoint, I think that, time is one of the most precious gifts that we can give back to clinicians, particularly now, right? So a strong IT solution that's developed by and for clinicians is going to improve user buy-in through easy access. These are already been mentioned, minimum number of clicks, providing information for the appropriate choice of antibiotic, a visually easy to read layout, and that meets compliance it needs seamlessly is going to be a great point.